Hi. I'm hopeful that what we present in the next hour will be useful for you, and for those you love in your own process of grief. Your own process of grief. During this time, I want to just start by offering my condolences. If you're watching this, it's probably because you have suffered a loss at some point recently, or maybe a while ago, and you still suffer from that. And I know that whatever we present in the next hour in terms of some education about grief and about using thought field therapy will be helpful to you in the way that fits for where you're at in your own process. I don't want you to think that anything that I say when I discuss the process or how things work with grief, that's a statement about what your experience is or how you must move forward. The most important thing to remember with grief is that there is no single way to do it that's right. And I hope that you'll find what I'm offering here in terms of information and also in terms of using the thought field therapy will help you move through your own process. I know through my experience in working with others and my own personal experience that tapping can allow you to experience things so that you can move forward. So we're going to spend a bit of time going through this. The most important thing I want to say to you is that the title of this is Grieving with a Purpose. People keep asking me, well, what's the purpose to grief? Well, the purpose to grief is to get to living well. And there's no way to avoid it. There's no way to get around it. When you've had a loss of a beloved one, you will have some sorrow. You will have some sadness. You will have some grief. And the key is to not get stuck in that and to be able to move through it to live well. So what you're going to get as part of this webinar is you've already received the basic tapping elements video, the link to that. It's an hour-long video of the basic tapping points, how to tap, the order of tapping for traumatic stress is on that video. Also a demonstration of collarbone breathing with some explanations of why we do what we do in thought field therapy. So that's very helpful. If you've not seen it already, I would encourage you to go look at it. It'll help make sense out of what we do here when I'm demonstrating the tapping. So you'll also receive this video presentation that will include this PowerPoint. Also, you received a handout, Healing Traumatic Loss of Loved Ones, that's basically a synopsis of my book chapter on grief. Those who've signed up will receive a free 15-minute phone or Skype consultation with me, and I look forward to meeting you. Please contact my office and set up a time to do this. I'm going to put a limit of 3 months on this so that it just doesn't drag on too long. I think you'll find if you use that I can help you very quickly identify where you're stuck in your grieving process and also give you a tapping pattern to help you move along with that. So I look forward to talking to you over the next few weeks, and that is included in this particular webinar. So what I hope will come out of this will be that you learn to use TFT to reduce your overwhelming upset. That will allow you to move through your process more quickly and more efficiently, and I hope bring you closer to that point of living well again. I hope that after hearing what we talk about here and viewing grief through the process that I use, you'll be more accepting of your own thoughts and feelings and more accepting of your giving expression to those thoughts and feelings. It's important that you find a way to be comfortable with that. Understand that your own process of change and integration is your process, and that it is something that does take some time, but the goal here is to integrate the loss in your life so that you can go on living well. And that's my way of thinking about the purpose of grief. You may find another way to think about the purpose of your grieving, but hopefully it will guide you and support you in your moving on as you consider your purpose for going through this process of grief. Now, again, grief is a very personal experience. Grief is a feeling. When we talk about grief, it's a feeling, it's an emotion, it's an experience. It's sorrowful, it's painful, or sometimes it's just numbing, because then you can't feel anything. The range of the way people experience grief is with all other feelings. It can be just a slight sense of something is there, or it can be all-consuming. And when you are struggling with grief and it's all-consuming, then it's hard to think when you're so caught in the feeling and in the emotion of it. So the thing that you have to understand, or that I hope you'll understand, is that grief is a normal process, and we expect it to happen. Now, we do look at a couple things if grief becomes a problem that interferes with your life choices. You aren't able to make decisions about how to move forward in your life because you get overwhelmed with this pain and upset. It also can be a problem if it's causing dysfunction in your day-to-day living, such as you can't sleep. If you go several days without sleep, your life becomes very dysfunctional. You can't eat. If you go several days without food, you're going to find that you're not able to think clearly. You're not able to act in a way that you want. So when those things are happening, you need to pay attention to it, and you need to address it immediately. It's not unusual in the first few days after a loss of someone you love to have very difficult time with sleep, with eating, with making sure that you're taking care of your daily tasks. That should get easier as you go along. You should be able to get yourself back to a routine and find yourself in a place where you're taking care of yourself very soon. If it doesn't, you need to reach out to help. It doesn't necessarily mean that you need professional help, but you may need to reach out to the other members of your families, to your friends, to your community, to people who can help you remain functional as you go through the worst of it. Also, remember, tapping does make a difference, and it can make it easier for you to be able to get the emotion to a point where you can manage to do your life's daily activities and to go forward. So when we talk about loss here, we're talking about loss of a beloved one. Now, that means different things to different people. So I thought to myself, well, what are some of the losses that pop into my head when I think the loss of a beloved one? Well, for some people, it may not be as powerful as it is for me, but my cat of 20 years died last week. That is a difficult subject for me right now. When I was a young man, my father died, and still to this day, I have strong feelings, mostly joyous feelings about my father, but when it comes to his death, there's still some grief, there's still some sorrow with that comes up. My godson died at age 11, and that's going on over a decade ago, but I still feel some sorrow with that, and at the time it was the worst sorrow, the worst grief I'd ever felt in my life. My best friend from high school died at age 52, and that was a long connection that I felt some loss with. My mother and father-in-law both died 6 months apart a couple of years back, and having lived with their daughter for so long and having been part of that family so long, there was grief, there was loss. And it was different than the loss of my father because I was at a different point in my life and because I had a different relationship. More recently, my thought field therapy teacher died, For those who aren't aware of it, Dr. Roger Callahan died in November of 2013. And I have feelings about him, and think of him in a very beloved way, as he did change my life. So I don't want you to feel like that there's more worthy grief, there's less worthy grief, there's you should feel more powerfully about one loss than another. Your loss is your loss, and you experience it the way you do. And I hope that you use what we talk about here and the tapping to help you with that. So, if I ask myself in terms of my losses, which is the worst, I have to look at where I was in my life when it happened. I have to look at how long I've grieved, how much time has gone by since then, and how much effort I put into moving through that. And also I have to look at what's in my life, because loss, when I have a lot of support and love around me, is different than when I found myself in a place of being very alone. So it's hard to say which is the worst for me of all those losses. Right now, the one I'm feeling most acutely is the loss of my cat. I'm still integrating that into my life, and I have tapped for that. So I encourage you to not forget to use what we're talking about here when you lose a loved pet. But again, let's go back to what's important here is the loss of your beloved, and that's the focus that we're working on here today. So before we go any further, and also to make sure that people are able to hear what we're talking about and how we're doing things, we're going to do some tapping right now. And this will be a review for those who've seen the video before, the Basic Elements video. For those of you who haven't, if you don't catch it all, that's okay. You can go back and review that video or this one later. But let's all tap now so we can maybe keep the emotion at a place where it's able to listen to what we're talking about, to what I'm presenting, and to consider some of the ideas that we're going to work through. So we start by whatever you're feeling right now, just rate it on a scale of 1 to 10. 1 being no upset, 10 being the worst you can imagine. Now, we've talked about, as soon as we start talking about loss in any shape, you'll get triggered into looking at the loss in your own life. And that's fine. What is important for you to remember is that whatever you feel as you think about that, those are your feelings. They're not right or wrong. But if they get to be too much, if they get to be too strong, you'll have trouble being able to hear. So just notice what you're feeling in your body now, and rate that upset on a scale of 1 to 10, 1 being no upset, 10 being the worst you can imagine. Now after you do that, we're going to tap, and we start by tapping the side of the hand, under the nose, beginning of the eyebrow, under the eye, under the arm, under the collarbone, then on the index finger, under the collarbone, little finger, under the collarbone. Now tap the gamut spot, the one on the back of your hand. Close your eyes, open your eyes, look down left, look down right, whirl your eyes in a big circle all the way around the room. Now whirl your eyes back the other way, hum, now count, 1, 2, 3, hum again, Then we repeat the pattern we did before, side of hand, under nose, beginning of eyebrow, under eye, under arm, under collarbone, index finger, under collarbone, little finger, under collarbone. Now rate the upset again as you notice what's going on in your body, as you're thinking about what you thought about before. And hopefully that will have dropped to a lower number. Now, when it gets down to a 2 or less on a 1 to 10 scale, then we do the floor to ceiling eye roll, and that's done by tapping the gamut spot. And now drop your eyes all the way to the floor. Now slowly roll your eyes up, all the way to the ceiling. And now switch hands, tapping again on the gamut spot. Drop your eyes to the floor, and then slowly roll your eyes up over 7 to 8 seconds, all the way to the ceiling. Now, if you're watching this as videotape, nobody does videotape anymore. If you've downloaded this presentation and you notice that your upset level as you try to listen is above a 4 or 5, you may want to tap again to see if you can reduce that even further. If it's up around 7 or 8, it's going to be very difficult for you to be able to take in the information being presented to you. So put it on pause and tap again. And the tapping pattern that we're using is the one for complex trauma. Now, the reason that we use that is because it covers a number of different emotions, and when we're working at the algorithm level, standard tapping patterns, it's often the one that gets the best result immediately. So go ahead and tap that again. You can replay what I just did, or you can look at your tapping the basics elements video at the end. It's the same tapping pattern as there. And we want to bring it down to a level where it's possible for you to be able to listen, to begin to think about these things, be able to consider how this works in your own life. So I want to say again that what we're doing here is general information that seems to work for a large population, but it doesn't take care of everything. And one of the things that you need to understand is that some some grief, it's a result of a loss, is a little more complicated than others. And what we find, if you look at the definition of complicated grief, you're going to find that there's some definitions, there are some situations that are more difficult than others for some. And that's if the loss was unexpected or sudden, if it was violent, if you witnessed that violence, it would be very difficult. If you're dealing with an incomplete relationship, complicates things, because what that means is that you have unfinished business, and sometimes you have to work through some of those issues before the grief can really be addressed, just in terms of the loss. If there is more than one loss at a time or several losses close together, it can be more work. It doesn't mean that that you can't use TFT, you can't do the work of grief. It just means that there may be some complications for you. Also, if it involves a homicide, suicide, terrorism, combat, or line of duty death, there's often other issues that have to be addressed. What other issues? Well, if you've witnessed the death of a loved one, that can be traumatic, and so you may need to deal with just the intrusive images, the upset associated with the terror of that, before you can actually start working on the grief in terms of the loss. So we'll talk a little bit more about that as we go along, but again, be aware that it takes whatever time it takes and whatever work it takes for you to be able to move through your own process. Sometimes grief can be resolved fairly quickly, and sometimes it's not. And by quickly, I mean sometimes within a few days, depending on your relationship, depending on where you are in your life, to years and years. It could be decades if it's someone who has been part of your life for a long time. Now, that doesn't mean that you'll be stuck in a dysfunctional place. It just means that those feelings of sorrow will come up, and you will need to find a way to work through them and to integrate the loss. So the other thing where it gets very complicated is what's called disenfranchised grief. And that's when you're on your own, that the relationship is not recognized, other people don't know that you're grieving because they don't validate your relationship. Or if they do acknowledge that it's a loss, that with somebody you have a relationship, they're going to say, well, it's not that big a loss. And so you lose support. The mourner is not recognized as a legitimate griever. Now, when that happens, it doesn't change your process. It just means that it's very difficult to find the support that you need to continue through this. So be aware that sometimes you will come up against people who are saying, well, it's not that wasn't really a loss for you, or it wasn't that bad of a loss for you, or you don't have a right to grieve. Well, you have a right to feel what you feel, and it's just that it makes it more difficult to find the support to move forward. So I want to be a little more clear with people now about where I think this process of grief is, and mourning and integrating the loss into your life. So, you begin at a place where you're frozen in the moment. And in that frozen place, you really don't have choice or control. You're just stuck. And that then you will begin to come to accept the change that's happened. So it's not unusual in the immediate aftermath of a loss for people to just get frozen, to not be able to accept that it's happened, to not be able to understand that the death has occurred and the person is no longer available. That can make it very difficult to move forward. After that time, it's usually a very short time, you'll begin to accept that the person is no longer physically available to you, and you'll begin to look at how your life has now changed. Now, in that process, you're going to start expressing your own thoughts, your own feelings, and it's important that you allow yourself time to sort through that. Once you begin to give expression to your own thoughts and feelings, you'll notice that you begin to change in how you deal with reminders, how you begin to deal with your day-to-day life. Now, the next piece is often very difficult because we're human beings and we have to give meaning to our existence and to our life. And so the only way to do that is to move from being frozen to accepting the loss, to understanding and knowing and expressing your own thoughts and feelings. The only way you really know yourself is when you begin to express what's going on. And you can do it publicly, you can do it privately, but it's an important part of coming to understand what this loss means to you and what the beloved person meant to you. Once you understand those things, you can give meaning to this experience. You can give meaning to the pain, can give meaning to continuing through the pain, can give meaning to finding a way to honor your loved and to honor your relationship with them, which is really where I hope that you go with this. I'm saying this just because some people don't, well, in my practice, I've had people come in and they talk about being stuck in their grief, and it's part of it is because they've never really thought about how does one move through grief to a different point in their life. And here I'm looking at the activities, I'm looking at the behaviors that people have. So you're living your life, you have a loss, and then you begin to live your life in grief. And then, over time, you're living your life in grief and more. Because then you can begin to live your life in some joy, joy in the relationships that you had, joy in the relationships that you're forming. So that's where we go with grief. Now, again, that's my process, and don't feel like you have to buy into this is the only way to do this. If you find that there's a better way for you, then you should follow that. So again, tapping reduces the emotional block to being present and able to think. Now, it's interesting that one of the ways that we sometimes deal with tremendous loss is we shut down and we go numb. And tapping can be used to increase the emotional guide to being present, so that you can be aware of what you're feeling and give some expression to your thoughts and feelings and begin your own process of integration by knowing yourself better and by being able to begin to think about what meaning you give to this. So let me just, I'm going to tell about a client who came in, and it's written up in my book and in the handout, but I want to just talk about it because I think it's important. This is a woman who came to me at a conference and who had a history of being, well, I didn't know what the history was. When I met her, she asked for some help with some grief, and I agreed to help her. And the woman was suffering terribly from the loss of her son, who had died about, I think, 2 years earlier. And she had just was overwhelmed by the thought of that loss. So as soon as she started to talk to me about that, she became overwhelmed. She started crying. She couldn't do anything other than just cry. She couldn't tell me the story. She couldn't move forward. So we tapped. Once we tapped, she could then begin to tell me the story of her son, who was an underwater diver, who was trapped in a landslide under the sea and was killed. And as she's telling me the story about that, she begins to become overwhelmed again. Now, this time, the feelings go up, the SUD level, subjective units of distress, goes up again, and she can't go on. So we tap again. And when she's able to talk again, I ask her what happened, and she says, well, the first time we tapped, she was just overwhelmed. She didn't even really have a specific thought in mind or focus of her tapping. But the second was she just felt sad. She could feel the sadness, and she was overwhelmed by that sadness. And so we tapped to bring that down. So then I asked her what she was feeling then, and she started to think about her son's death, and she thought about how terrible it must have been for him to be crushed in a landslide under the ocean, and what that must have been like. And she got in touch with some pain as she was telling that story, just the emotional pain that her son must have suffered, that she felt for her son. And so we tapped again. Now, after reducing the SUD level again so that she could talk some more, we started to talk a little bit more about her son and about their relationship. And suddenly, as she's talking about the fact that he was an energetic young man who loved his work, he loved diving, he loved making a living at this, and she began to feel upset again. Now, this time we tapped, but the focus of the upset was her sense of guilt, that somehow her encouraging her son to go off and be a diver and to take these jobs was the cause of his death, and she felt some responsibility for that. Now, once we tapped for that guilt, and she knew it wasn't reasonable, she knew that she was just doing what a mother does to encourage her child. So, but after we tapped, the emotional overwhelm came again down to a point where she could talk a little bit more. She started talking about her son, again about their relationship, and then she was saying, well, our relationship was pretty good, but we'd had some difficulties because I'd been angry at him because of the way he was dealing with some of his relationships and who he was relating to, and I just, I didn't like how he was handling some things, and so I was angry at him. And she said, and that anger is still there. And so we tapped for the anger, and the anger came down. And then she started sobbing. She started deep emotional sobbing. Very, very powerful, woeful feeling coming through. And it was interesting because at this point, I said, let's tap again, because I didn't know what was going on. And she cried for a bit, and then she said no. And then I said, well, can I help you with this? Because this is very powerful. I'm feeling what's going on. And she said, she was able to tell me. She said she didn't want to tap. She said this is the feeling she'd been trying to get to for a long time. What was happening was she was remembering the last time that she saw her son off at the airport, and she was feeling what it felt like to hug her baby. And she remembered the last time she'd hugged her son goodbye. And when she came in touch with that memory and the feelings that were with it, she was just overwhelmed with all the sadness. but it was what she wanted to get to, something she hadn't been able to feel. Now, the interesting thing about this woman is she was a professional counselor. She had worked in hospice, and she understood grieving and how to help people through that process. But she'd not been able to get there because her feelings were blocked at that deeper level. So she was able, I usually don't like to leave people crying, but she felt that those tears, that sadness that she was experiencing was part of her process to be able to move through those feelings and to deal with them. So I left her that way. I got a card from her about 6 months later telling me that she had been able to complete some projects honoring her son in terms of a garden that she wanted to do, a couple other things, and that she was doing well. I wrote this story in my book, and a few years after this event, I was doing a training, and I was told by one of the participants at the training that came up after I told the story and mentioned that it was in my book. And she came up and she said, "Well, I know that woman." And I said, "Well, we all know those people in our lives. We've had those kinds of experiences." She said, "No, I know that specific woman. She's a friend of mine, and she has been doing quite well since the tapping." And this is, I think, 3 years after we had done it. And she was very pleased to report that her friend was doing well and had integrated the loss of her son and was moving forward in her life. So the reason that I talk about this is because there's a number of emotions that go along. It's just not the sadness. It's just not the sorrow. It could be other feelings having to do with your relationship and needing to work through those. So it's important that you begin to think about what kind of emotional experience you're having in regards to your beloved. Are you being able to access all the emotions that you need? So I'm going to tell one more story, and then we're going to tap again. If you can hear it, if you can't hear more at this moment, it's okay to put it on pause if you're listening to the tape. And say, I did it again, listening to the tape, listening to the recording of this, and tap at this point. But I want to tell another story because I think it's important to understand that sometimes it's just the sadness that keeps us from being able to move forward in life. So I was working with this woman who had volunteered at a conference, who had lost her son, I think about 3 years previous to this conference. And she came forward and said she needed some help with it. And it had been a very sad story. Her son actually died in her arms. He was the victim of some violence and managed to make it back home and died in her arms as they were waiting for help. But the interesting thing is that the thing that she was in touch with was just this sadness, this feeling of holding her son and just seeing his face and being locked into that. So we started doing some tapping, and she described the feeling as just sadness. So we did a round of tapping, and she could feel some shift in her at that point with that sadness. There was sadness there, but it still wasn't the same level. And she said the interesting thing was that before we tapped, she could just see his face, but after we tapped, she could begin to see more of him. So we tapped again, and again she reported some sadness coming down, and she was able to expand her perception again further. And as we tapped for the sadness again, she began to be able to see the situation that she was in. Now, this sadness was very powerful, and when she was just locked into seeing her son's face and feeling that loss as he died, she couldn't see anything else. So the interesting thing is we did several rounds of tapping, and at some point she said, oh, she just had this revelation that something was different. And I said, well, should we tap more? And she said, well, she said, I don't think I need to do that now. She said, I have some other things I need to do. And I said, well, what's that? And she said, well, as I've been able to let some of the sadness heal, I've been able to see more of what was around me and of that situation. And I just noticed that as I saw the situation, as I saw the room and the context, I was looking around and I noticed that his brother was standing at the doorway, and that he had watched this whole scene also. And it suddenly occurred to me that what I need to do is to go talk to that surviving son. That he needs help with this in the same way that I needed help with this. And she hadn't been able to be aware of that until now. So she felt like that it was important for her to move through all of these feelings and to recognize what was going on so that she could now go help her son, her living son. So again, this is a story that I hope illustrates that it could just be sadness, and the tapping can be very powerful in helping moving forward after 3 years. So it was a different experience for her. So let's tap again. I'm going to go through, I want to review with you again. Tap the side of the hand about 10 times. Tap under the nose. And we just do about 10 times everywhere. Beginning of the eyebrow, under the eye, under the arm, under the collarbone. Index finger, collarbone, little finger, collarbone. Tap the back of your hand, close your eyes, open your eyes, look down left, look down right, roll your eyes in one direction, roll your eyes in the other direction, hum, count, 1, 2, 3, 4, hum again, and we're going to repeat the tapping pattern, side of hand, under nose, beginning of eyebrow, under eye, under arm, under collarbone, index finger, under collarbone, little finger, under collarbone. Stop and notice what you're feeling right now. Now, I didn't have you rate it before we started, but notice what you feel right now, and make sure that the feeling is at a level that you can continue to listen and that you can begin to consider some of these ideas for yourself. So part of what I'm hoping that you're recognizing is that grief, sorrow, not one feeling, not one particular focus. It can move from one thing to another depending on your relationship, depending on the events, depending on what was going on for you. And you need to be able to look at that, to feel it, to express it, to think about it in order to be able to integrate it. And that's what this grief process is about, is integrating this loss into your life in a way that makes sense for you. So while you're doing that, you really have to take care of yourself. And again, I said that we're concerned if the grief comes to a point where you cannot take care of yourself or take care of important elements of your life. So remember, grief has no timetable, but it also will not last forever. You need to hold on to that thought, because people have had grief throughout the ages. It's part of what it is to be human. And we do find a way through it. And you will too. We just don't know how long it will take or how much work it will take for you to get there. But it won't last forever. So while you're working through this, you have to remember that you are human. You need water, food, sleep. You need to be connected to others. And you need a purpose. And all of these needs continue, whether you're feeling sorrow, whether you're feeling loss, whether you're alone, whatever. You have to deal with those human needs. So you use the wisdom of the support and support of your community, of individuals, of families, of friends, of groups who are available to you. I'd mentioned that there are groups, some grief is more complicated than others, but there are also groups who will help you with that. There are groups that will help if you are the survivor of a suicide or of a homicide. There are groups specifically designed to help you with that process and to help you with those issues that are specific to it. You can reach out to them. And Trust that there is information, there are processes that will be useful to you. And always remember, stay aligned with your own nature. What is important to you? What is the way that you operate? What you want? And you have to hold on to that as you suffer the loss. You still exist. You still continue. Remember when my father passed away. He died. Wasn't sudden. He died of cancer. We knew it was coming, but it was very, very difficult for my mother. She was 51 years old when this happened. A very young woman, in many ways. Now that I look back on this, but I remember her talking to me about, at one point after his death, and I think it was probably a few months, that she said that she had to look in the mirror and remind herself that she wasn't dead, that she was alive, she didn't die. And to do that took a tremendous effort on her part, but she had to come to accept that her life would go on and was going on. And that's part of what is in her nature, which is to recognize the reality of the situation and come to find a way to accept it. That was not an easy integration for her. Her life had been about her husband, her children, her family. And to this day, she still has sadness and grief when she thinks about my father, but she has integrated that into her life and is living well. So take care of yourself, look to your community, look to your friends and family for support. Now, if you're interested in how far you've come in terms of your own grieving process, the way that I do this in my office or in my own life is I ask the question, can you tell the stories of your beloved? If you can tell the stories, then you're moving along. And can you tell these stories with appropriate affect? Just as we're talking about traumatic stress, can you tell the story of the event with appropriate affect? Appropriate affect means that when it's sad, you feel and express the sadness. When you are angry, you express the anger. But again, you don't get so angry that you put your fist through the wall, or you don't get so sad that you can't continue and melt into a puddle of tears. Appropriate affect means that there are feelings with each aspect of the stories that you share, and you're in touch with them and expressing them. And so can you find your way onward? You know, the other question is are you moving forward in your life in some way? And that will answer the question of how far have you come in your grief and in your grieving. So when we talk about telling the stories, we're talking about stories before the death of the beloved one, stories of coming to know one another, stories of shared moments, stories to be remembered, things that you want to carry on about what was the life before your beloved's death. Your life, his life. Now, then you're going to want to be able to tell the stories of your beloved's death. And that's important because it's information that we need to be able to share with those we choose to. You don't have to tell everybody. And you probably shouldn't tell everybody about what it was like for you to go through that process and what it was like for him or her to go through the process of their death. But it's part of your story, it's part of your life, and it's okay to share that with people who care about you and care about them. So, and then there'll be stories about how you've lived beyond that. Stories of your living to honor the lessons of the beloved, what they taught you, what they brought to your life, and how you've gone on to live in that way. Stories of living as well as I would have expected by my beloved. Now, that's not real clear, but what I'm saying is there needs to be stories about how you're living in a way that you would have wanted your beloved to live. So, if my wife died tomorrow, it would be devastating. If I died tomorrow, it would be devastating to my wife. But I would expect my wife to go on and to live her life well. I want her to feel joy in her life. I want her to feel connected. I want her to feel good about the life she has. So I would hope to hear stories about how she's lived well without me. So that's what I'm saying is, if you can tell stories about how you've lived well without the other, the same way you would hope they would tell stories or have stories to tell about themselves if you were the one who was gone, that's an indication of where you're at in your grief process. Now, are you there? You know, probably not, or you wouldn't be looking at this video. But can you get there? Yes, you will. In the same way I can tell stories about my father, then I can feel all the feelings that go with that, with appropriate affect. Stories of our interaction, stories of his death, stories of what I've taken from his death in living my life. So that's one way to know things. Now, another way to kind of know where you're at in your own process, and this is where you need to tap, because if when you're telling your story you start to be overwhelmed, you tap, because that brings the feelings down to a manageable level. Now, another simpler way to think about this is just to make the statement, I accept my beloved is no longer physically with me. Rate what you feel. If you feel upset, tap is needed. Okay. Now, I just want to make a point here that that if the tapping sequence that we're giving you here isn't working, don't be concerned. It just means that you need a more specific tapping pattern. And there's more information about that in my book, Heal Traumatic Stress Now, Complete Recovery with TFT. In Dr. Callahan's book, Tapping the Healer Within is an excellent source for just basic tapping sequences. Also, if you need assistance, you can certainly talk to someone who's been trained in TFT who can give you a more specific pattern using what's called causal diagnosis. And this can be done in person or over the phone. You can also learn to do this for yourself by doing online and live trainings through Callahan Techniques. So there's lots of other things available. Most of the time you're going to find that you will get some relief using the basic tapping patterns that we're showing you here. But if you don't worry about it. It doesn't mean that there's anything particularly unusual about you. It just means that you need a different tapping pattern. You know, I would say 8 or 9 out of 10 times you're going to find relief using the basic patterns. If you don't give up. Reach out, find somebody who can give you something a little more specific. So if you try that, making that statement, and I usually like to just hold my heart as I say these things, because I think it helps me be in touch with my feelings. And if you make that statement and your upset doesn't go over a manageable level, then you've come a ways. But that's the first statement. Now, with children, I just want to mention that with children, it's the process of grieving can be different because they're at a different developmental stage depending on when they have had the loss. Some children don't fully understand the concept of death, and you can talk about someone having died, but it doesn't have any meaning to them until by the time they're 8 or 9, they're going to have a really firm concept of what death can be. But you know, a younger child may struggle with understanding that it's permanent, may struggle with not knowing that they aren't coming back. So they don't understand the concept of death, but they do feel the absence, the change that's happened. They just don't know what to do with it in the way of thinking. So we have to help them with that. That's another video altogether, and a lot of time talking about the specifics of how to help children. But again, there's lots of information out there, books, resources online, and groups to help you with that. So if you can make the statement, I accept the loss, try the next statement. I accept my feelings and thoughts, good and bad, that come with this change in my life, and see what you notice. Now, this is one of these things where you can identify a specific thought and say, I accept my thought that it was not in the right time, or it wasn't just that this happened. I accept my feeling that I was cheated. You can talk about specific feelings that have been big in your way of dealing with these things. And then as you name them, notice what you feel. if it's too much, if it gets in your way of being able to go forward or to deal with it, then you tap. So remember, we're talking about a lot of different thoughts and feelings that we have as our life changes, as we look at what's happened to us with the loss of our beloved. So it can take a while, but it is definitely worth pursuing. And the tapping can help you do that. And once you can give expression to your thoughts and feelings, you begin to come to a place of being able to understand the meaning of the relationship, the meaning of the loss, the meaning of your life. And you have to do that in order to move forward and to get unfrozen. Now, the other statement, the one last statement I would suggest is that you try, I accept new experiences in my life without my beloved's physical presence. And what that means is that things will go on in your life that are different. They may be the same, but it's going to be a new experience because you're not with them. And to be able to accept that, then you can move forward with your life. Again, you can be specific and take each new experience as you go along, and pick the one in the time and the size that fits you in terms of the things that you're taking on as new experiences. It may be the mundane things that you always did before, and this is why anniversaries are so important, because the first time you do your taxes on your own, it's going to be a new experience, even though you may have done your taxes hundreds of times before. Well, maybe not hundreds, but you know, you've had decades worth of doing your taxes. Now you're doing it on your own. It's a new experience. So you may need to tap for that. You may need to suddenly realize that the first birthdays, the first anniversaries, the first holidays, the firsts are often make us aware that it's a new experience, even though we've done it many times before. And sometimes it's hard to accept this change and to accept the new experience, and sometimes there's feelings that get triggered in us that we need to help, and tapping will help resolve those feelings. Now, the reason that I keep going back to the importance of being able to give expression to your own thoughts and feelings is because that's what it means to be a free person, and that's what it means to live a life fully, I think. Every person has the right to his or her own feelings and the right to give expression to them. Every person has the right to his or her own thoughts and the right to give expression to them. Everyone has the right to choose his or her actions and carry them out in a manner respectful of others' rights. Now, this is what I call living well. One element of that is living freely. Now, if you get frozen in your grief, if you get overwhelmed and you can't allow yourself your own feelings because you're locked in this sorrow, then you're not living freely. Probably not what your beloved want. If you get locked in this overwhelming emotion and you can't have access to your own thoughts and can't find a way to talk about them, you're frozen and you're not living well. So what I hope you understand is that what we want to do with the thought field therapy is to encourage you to move through your own integration process. And the integration process is best understood in terms of the actions that you take and that the way you live your life. Now, if those rights get violated, if you can't express your feelings, if you can't give voice to your thoughts, you know what? It's a source of violence or injustice that either others are imposing on us through cultural values or expectations or through our own demands on ourselves. When one is a victim of violence or injustice of any sort, we have a natural physical and emotional response that often changes our behavior. And what we want you to do is to be aware of what's going on when you block yourself or when others block you from feeling and expressing your thoughts and feelings, no matter what they are. And people may not understand why you feel what you feel at any given moment. It doesn't matter. You feel it, and you have a right to that feeling, and you have a right to give expression to it. And through giving expression to it, you begin to be able to understand it better. And by doing that, you begin to be able to work with the meaning that you have for this loss and for life, and to find your way moving forward. Now, if you find yourself not able to control your emotions, not able to control your behaviors in a way that makes it unsafe for you or others, you're going to be acting out in some way. And oftentimes when that happens, you do this until you're exhausted. You can sob hopelessly until you're exhausted, or you can sob hopelessly until you're taken up in the arms of those who love you and held, so that you can't continue to be alone. It's like someone whose grief is so overwhelming and they experience it only as anger, and that anger becomes outrageous, and they start wanting to take it out. They start wanting to express it and act it out. Okay, that's all right. You have a right to expressing what you're feeling, and you're going to be caught in that until you're exhausted by it, or if you're doing something that's dangerous or unsafe for yourself or others, until you're contained by others so that you can't. Now, sometimes when we're overwhelmed by emotion, we just go numb completely, and you feel nothing at all. This is not being in control of your own life, because you no longer have access to your thoughts and feelings. You can't give expression to them. You can't give meaning to what's going on. You can't make choices in your life. So we have to reconstruct our reality. The other thing that may happen is sometimes we reconstruct our reality in a way to avoid or dismiss the harm or our reaction to it. So we remember things differently than other people do. We remember things in a way that allow us to contain our own emotion, to not be overwhelmed by our emotion. And that's okay, as long as it doesn't get in the way of you understanding the realities and living in your life. Now, another thing to do when people are emotionally overwhelmed is there's other things you can do to help. Medication, meditation, distraction, cognitive processing, all of these things will help you manage your overwhelming emotion. The most effective, of course, is tapping. But the reason that I'm mentioning this is because sometimes in the grief process we feel completely out of control, or we seem out of control. There are things that we can do to bring ourselves back into control. And I encourage you to use tapping, but there are other ways to do it. But you have to keep yourself safe, and you have to keep yourself healthy. And people who are going through grief, who you love and care about, sometimes need you to help them be able to do that. So remind people to tap. One of the most helpful things you can do, if somebody's done tapping and it's helped them, that when they start to be overwhelmed, it's sometimes difficult to be able to think, to be able to remember that you tapped before and it helped. So remind them to tap. Remind yourself to tap. Put some reminders up. Now, we talked before about in order to get through the grief process, you may have to do some other steps. So a story of a woman who came to me when her actually fiance ran off the road, and they were staying up in a cabin. She and her fiance and a girlfriend and her boyfriend were there. Her fiance and the other woman's boyfriend went off down the road, and they saw them run off the road, and it rolled down a mountain. And by the time they got to the person, to them, they were trapped in the car. They couldn't get out. They sent for help, but she stayed with her fiance, who was trapped in the car, as he died. And she talked about the minutes they had together while she was there. Now, she was having trouble grieving getting through the feelings and integrating this loss in her life, because she was having intrusive images, she was having nightmares about what had happened. We had to work through the traumatic stress part of that before we could just get to the sadness and the sorrow of her loss. And that happens oftentimes, that sometimes you have to work through traumatic stress, you have to work through issues of injustice and anger with others, before you can get to some of those places where you can just feel the sadness and the sorrow and to accept the loss. Now, I just want to mention that in order to get through sometimes that injustice or that anger at what has happened, there's no answer. There's no way to really fully release the feelings and to fix the injustice, to right the wrong. And when you get to that place, sometimes forgiveness is what you need to do. So I just did a webinar, the last webinar was on forgiveness. And so I want to mention it here because I think it's important for people to recognize that you can get as angry as you want at the world for having taken their loved one, but at some point you have to come to acceptance. Now, if you can't come to a way to release those feelings and to accept that there's no way to right this wrong, you're going to be stuck in that forever. So sometimes you just have to forgive the world for the way that it is. Sometimes you have to forgive yourself for the way you are. Sometimes you have to forgive your beloved for the way they were, because there's no way to set it right. And so that's where forgiveness becomes important. Now, the other thing that's important oftentimes in grief is that you have to recognize that to move through this process, you have to come to a place of making a commitment to living your life, a commitment to moving forward, and a commitment to what's important to you and what honors your beloved. And these things are not easy to come to, but this is part of the process, and this is why it's important to have people to talk to about what you're going through, so that you begin to recognize how you get there and what is important to you. So forgiveness, I just want to go quickly through this, does not require that you forget, does not even require that you continue the relationship. That's why what we call unilateral forgiveness is so useful when we're dealing with death, is because it does not require that they participate in the process. Forgiveness, when you need a sense of forgiveness for yourself, it doesn't have to be granted. If you forgive somebody, it's a choice you make. It's not a choice that you have to do. I'm going to encourage you to get a copy of the video on forgiveness if that really becomes an issue in your life, because there's a lot about that. I want to focus on unilateral forgiveness, which is often what you have to do when the other person's no longer available to be able to resolve this issue. And it's the only way to go forward, is to let go through forgiveness. And oftentimes, like with the death of a parent, I've done this many times with people, to help them to understand that the parent will never change. And especially if they're dead, it's not possible to engage in any process with them. Again, it may or may not require some forgiveness to be able to grieve, but it is important that you look forward to doing that. I'm sorry, it says next webinar at the end, but it was the last webinar is where we focused on forgiveness. So if you want to experiment with it, again, it would be one of those statements that put your hands over your heart. I forgive, and the example here is my father for leaving me when I was defenseless child, releasing all resentments, anger, and pain, and releasing my expectation of anything more. You make that statement, and if you're overwhelmed by emotion, it means that you really haven't been able to get there yet. And you may need to tap. And you may need to rethink what it means to forgive. You may need to rethink what your relationship was to them. It may turn from going from forgiveness to acceptance and understanding that what was done to you doesn't require forgiveness. It certainly requires, however, that you come to a different understanding of it. So you can work with that and it will be helpful. The other thing is self-forgiveness, because a lot of times we have feelings that we didn't do well, we didn't do right, that we did harm to another, and once they're gone, there's no way to set it right in terms of that individual. So this is where self-forgiveness becomes very important. And as you go through this process, you'll begin to understand that there's ways you can do this that have to do with cognitive shifts, understanding your position, understanding what was going on with you. But if you need to forgive yourself, there's a way to do that. And tapping will help you do that, because forgiveness is a feeling. And here the statement would be, I forgive myself for harm, choosing to continue to damage my brain with drugs, resentment, anger, and pain, and releasing any expectations of more of myself in regards to this past decision. So that would be an example of forgiveness, not trying to correct the wrong that was done or the harm that you caused yourself or others, but to accept that you can't fix that at this point and to forgive yourself. Now, of course, you can make a commitment to doing better. Of course, you can make a commitment to making change. But using thought field therapy to help you with the overwhelming emotion, you can think about these things. You can talk about these things. I said before, when you're in a state of forgiveness, there's a feeling to it. It's my body's relaxed and I'm energized. My emotions are positive. My thoughts are fluid and expansive. I don't feel locked into it or overwhelmed. My heart is open, light, and connected. My soul is free. And when I'm in a state of forgiveness, when I'm forgiving those who've harmed me, when I'm forgiving myself for things that I can't fix, this is where you want to get to be able to think about these things, to talk about these things. In the state of forgiveness allows you to move forward in your life. And sometimes that's necessary in the process of grief and grieving and of integrating the loss of a loved one. So again, I want to remind you that traumatic grief there's more work, and there's going to be more elements to it that need to be worked with. Now, I'm presenting to you some basic information here. When people walk into my office and ask for my help, we start at a very different place, and we start wherever they are, because that's what's important. But thought field therapy allows us to do this in a way that no other approach has ever allowed me to work with people or to help myself. So again, I'm encouraging you, tap often, tap frequently. Remember, we want to move you from the place where you're frozen in time to an acceptance of the change, to knowing and expressing all your thoughts and feelings about that change and about that loss, and being able to work to giving meaning to your own experience and giving meaning to your life. And hopefully that's living to honor your beloved and your relationship with them. Again, living your life, loss, living your life in grief, living your life in grief and joy. And hopefully, as you move along, there is more joy than grief. And soon, your life is mostly back to joy, if it was before the loss. And some grief, there will always be some sorrow at the loss of someone you love. But it's not the overwhelming component of your life. It's not controlling what you do. So, I hope this has been useful to you. If you want more help, you have the opportunity to have a free consult with me when you bought this webinar. Also, you can go to my website and get my book. There's more videos. There's free videos of me doing some tapping there, of some experiences with other people. I do training, and I help individuals in person or on the phone with Skype. Also, the other major resource I would like to point out to you in regards to thought field therapy is Callahan Techniques, rogercallahan.com, and you can get online and live training in becoming a thought field therapy practitioner. So I hope this has been helpful to you. I'm going to close at this point. If you have on the webinar, it's possible to give me questions. I want to just, let me check, see if there's anything. Let's see if I've got any. Okay, I think we'll leave it at that point. I encourage you to tap when we stop, because it's good to practice tapping. And if there's anything I can do to help you, please feel free to give me a call or send me an email. I wish you well as you continue to struggle through your process of integrating the loss of a loved one. Good luck to you. Bye-bye.